Hello everyone, I am Dr. Tejasvi, consultant doctor in Fidicus Homeopathy. In our previous video, we discussed about what is ovarian cyst, its types and their symptoms, causes and risk factors. In this video, we will mainly understand the investigations to identify this ovarian cyst and also the treatment options available for these conditions, their precautions and the neglecting complications. I can explain this clearly on the board. Let's move on to the board. Now let us understand the possible investigations to identify the ovarian cyst. These investigations not only helps to identify the cyst, it can also help to diagnose the which type of cyst it is, like functional or pathological cyst, are the size of the cyst, location of the cyst, or should be identified by this investigation. The first most investigation is pelvic ultrasound. This is the first line of investigation. In this, you can identify the size of the cyst, location of the cyst, and also the any septum are there in the cyst condition. Next one is transvaginal ultrasound. These tests also visualize the ovarian cyst clearly when some ovarian cysts are not detected by the ultrasound. It can clearly visualize the ovarian cyst and it can also identify the contents in the cyst. Is there any serous fluid or water or any hair particles are there, should be identified by using transvaginal test. Next one is Doppler study. Doppler study helps to identify the blood supply to the ovaries. By this Doppler study, we can identify the is the functional cyst or the malignant cyst should be identified by this Doppler study. Doppler study mainly identifies the blood circulation to the ovaries. Next one is hormonal study. In this hormonal study, the female hormones like prolactin, follicle stimulating hormone, estrogen, progesterone, thyroid stimulating hormone should be evaluated. Next is pregnancy test. By doing this pregnancy test, we can identify any ectopic pregnancy are there. If ectopic pregnancy is present, this pain can also mimic the ovarian cyst pain. Next is tumor markers. These tumor marker tests should be done in persons who are 40 years and above. By doing this, we can identify any malignancy tendencies there or not in the ovarian cyst. Next is MRI pelvis. MRI pelvis should be done when there is no proper identification USG or transvaginal ultrasound. In this condition, MRI should be advised. Next is diagnostic laparoscopy. This laparoscopy can also function as diagnostic as well as therapeutic. If there is small ovarian cyst are present, by using this laparoscopy also we can remove that small ovarian cyst. These are the possible investigations to identify the ovarian cyst condition. Now let us understand the conventional treatment available for this ovarian cyst. Usually, these conventional treatments mainly focus on the presenting symptoms, but it doesn't address on the root cause of the condition causing ovarian cyst. If there is pain in ovarian cyst condition, doctors usually advise painkillers like non-steroidal anti-inflammatory drugs and also ibuprofen, naproxen. All these should be advised. By using these medicines also you can control the pain temporarily. Long-term use of these symptoms can cause gastric symptoms, acidity and also bloating sensation. Next is hormonal therapy. In hormonal therapy, oral contraceptive pills should be advised. By using these oral contraceptive pills, we can control the growth of the ovarian cyst up to temporarily. In these hormonal pills, they advise oral contraceptive pills and also progesterone hormone pills. Next is hormonal IUDs, intrauterine devices. All this should be advised in ovarian cyst condition. But problem is long-term use of these hormonal tablets can disturb the natural hormonal production in our body and it can also cause side effects like weight gaining, mood swings, anxiety development and also depression should be developed by using these hormonal pills. In case of PCOS related ovarian cyst condition, PCOS drugs should be advised like metformin drug should be advised. But long-term uses of these condition also causes some side effects. Next is surgery. Surgery may be advised in case of any torsion or rupture conditions. You can identify this torsion or rupture with severe pain, sudden pain. By this, you can identify the condition. In surgery, also some risk factors are there like infection, bleeding, and also recurrent occurrence of the ovarian cyst. So, conventional treatment mainly focuses on the presenting symptoms. It doesn't address on the root cause of the condition causing ovarian cyst condition. Now, coming to the homeopathic approach in case of ovarian cyst condition. Homeopathy mainly focuses on the balancing hormones. It can control the ovulation process and it can also balance the hormones in the female body. By using homeopathic medicines also you can control the presenting symptoms like pain, severe bleeding, ovulation disorders and also bloating sensation, back pain should be controlled by using these homeopathic medicines. Homeopathic medicines also affect on the root cause of the condition causing ovarian cyst. So this we can prevent the recurrence of the condition and it can also prevent the growth of the ovarian cyst to long extent. By using these homeopathic medicines, we can prevent the changing of the normal tissue to the malignant conditions. Homeopathic medicines are safe. These medicines are used from children to the adult age. They don't cause any side effects because homeopathic medicines don't contain any hormonal tablets. Next is homeopathic medicines affect from the root cause of the condition causing ovarian cyst. So it is the most effective treatment of ovarian cyst condition. Next is with the timely treatment of homeopathic medicine, we can control the malignant changes of ovarian cyst condition, and it can also prevent the growth of ovarian cyst into larger size. So homeopathic medicines control the hormonal imbalance, and it can also prevent the recurrence of the ovarian cyst, and it can be safe for using. Now coming to the precautions to be followed to control this ovarian cyst condition. Among the precautions, the first most precaution is regular follow-ups. In this, if you are identified ovarian cyst condition, you have to follow repeated scans for every 2 to 6 months. By this repeated scans, you can identify the condition of the cyst, like any size change in the cyst condition, any abnormal formations, any septum formations will be identified by using this regular follow-up scans. Next one is avoid heavy weight lifting. By avoiding heavy weight lifting, you can prevent the rupturing of the ovarian cyst, and it can also prevent the torsion. Next is managing weight and stress. Maintaining ideal weight can control the hormonal balance in the body, especially estrogen and insulin. These are essential for the growth of the ovarian cyst condition. And stress management is essential in case of ovarian cyst condition. This stress can cause the hormonal imbalance. So, proper stress management and ideal weight is essential in case of ovarian cyst. Next one is avoid unhealthy foods, like avoid sugars, refined foods, and also processed food should be avoided. And also increase the intake of anti-inflammatory foods and also fruits and vegetables. This can increase the natural immunity in our body and also maintain hormonal balance. Don't disturb the hormonal balance with unnecessary medications and also unnecessary lifestyle practices. Next one is avoid self-medication. Don't take any hormonal pills without doctor advice. This can cause the further increase of the hormonal balance. Don't take unnecessary medications. If you have any infections in the pelvic cavity, consult for doctor for early treatment. These infections can also travel to the ovarian cavity and it can lead to infection. So if infections are there, treatment is the must and only option to prevent the complications of ovarian cyst. By following these simple lifestyle practices and also regular checkup, we can control the growth of the ovarian cyst condition. Now let us understand the neglecting complications of ovarian cyst. Usually there are so many complications of neglecting ovarian cyst. The first most complication is torsion. It means ovarian torsion. Ovarian torsion, when the size of the ovarian cyst increases gradually, it can lead to torsion of the ovarian cyst. Usually around the torsion, around the blood will circulate into the ovary and it can stop the circulation of blood to the ovary. With sudden torsion also causes sudden pain, nausea, vomiting and fainting condition. Next complication is cyst rupture. This cyst rupture can be identified with internal bleeding, fainting, nausea. This internal bleeding also causes severe complications. When we neglect the pelvic infections, it can travel to the ovaries and cause ovarian cyst. When these ovarian cyst is also neglected for long time without any treatment, it can also infect with other infections and cause fever, inflammation changes in the body. Usually this ovarian cyst can last for only months or days. But when these ovarian cysts persist for too long time, can cause ovulation imbalance like improper releasing of the egg condition. So conception may be difficulty in the couples. It can lead to infertility. Next is when the size of the ovarian cyst is gradually increasing, it can cause pressure symptoms in the surrounding organs. When the cyst of the ovary is increasing, it can build pressure upon the urinary bladder and the bowels, resulting in painful urination or frequent urination, constipation symptoms. When there is tendency of ovarian cancer in the family, if you have any ovarian cyst, you can neglect this ovarian cyst. It can lead to malignancy condition due to tendency present in the families. So don't neglect the ovarian cyst. With proper right time treatment, we can prevent the malignant changes in the ovarian cyst. So torsion, rupture, malignant changes and infection are the common possible complications of ovarian cyst. If you are struggling with ovarian cyst symptoms, contact Fidicus Homeopathy. What do you get from Fidicus Homeopathy means the success of case mainly depends upon the three main steps. One is the treating doctor, second one is the drug device we are following, third one is the infrastructure we have. At Fidicus Homeopathy, doctors are with passion, qualification, knowledge, experience, competence and compassion. The drug device we are following is of top quality medicines. We are getting our medicines from best pharmaceutical industries and we are also best in segment. The infrastructure we are using is of latest technology and also artificial intelligence. By using this latest technology and artificial intelligence and treatment option, we can give better results to the patient. Now coming to the consultation part of Fidicus Homeopathy. Fidicus Homeopathy provides two types of consultation. One is online consultation, second one is in-person consultation. In online consultation, audio and video call options are available. By using these options, you can share your reports to us. If any reports are necessary, we will let you know. You can get it back locally and send it back to us. After completing the case taken, the main treatment will be started. Once the treatment is started, we will ship your medicines to your doorstep wherever you are in the world. If you are staying in India, it will take 3 to 4 business working days. If you are staying other than India, it will take 3 to 8 business working days. If you want to consult Fidicus Homeopathy by in-person, you can visit our nearest branch and get consultation. Now coming to how to consult Fidicus Homeopathy. This is our WhatsApp number 7999710130. By using this number, you can call or message to us and get consultation. If you have any doubts about Fidicus Homeopathy, this is our website www.fidicus.com. You can visit our website. By this website also you can get consultation. Why Fidicus Homeopathy only? There are so many corporate hospitals are there. So many homeopathic hospitals are there. Why Fidicus only means Fidicus Homeopathy stands for highest chance of health. And also Fidicus Homeopathy mainly follows three main principles. One is the highest success rate, second one is the transparent treatment, third one is the personal care. Regarding this ovarian cyst condition, we are having highest success rate and we are also providing transparent treatment. Transparent treatment in the sense we can explain the condition to the patient clearly. We can also provide personal care. Homeopathy system mainly based on the industrialized system, so that we are providing personal care. We can give each and unique treatment to every patient and we also advise them to maintain a healthy and balanced life. All these are the advantages of selecting Fidicus Homeopathy. Now we discussed about the investigations to identify this ovarian cyst, treatment options, their precautions and the neglecting complications. Remember, early diagnosis and timely treatment can control the ovarian cyst, and the early treatment can prevent the complications like rupture and torsion. If you are struggling with this ovarian cyst, contact Fidicus Homeopathy. Thanks for watching.
Fidicus Homeopathy.